our next panel on children's mental health in a changing climate. And I want to invite those speakers for the panel on stage while we watch a video from one of the youth plaintiffs in Montana. So if y'all could come up to stage, Leyla, Sam, and Shalini. Thank you. All right. And we'll go ahead and push play on our video. Yeah, absolutely.
Hi, my name is Seema Wadwa. I'm the
All right. Okay. We'll have the video going in a sec.
Hi, my name is Eva. I'm 17, and I'm from Livingston, Montana. I absolutely love this place. I love the mountains, I love the rivers and the sky, and all of the wilderness it has to offer. The wildlife here is incredible. There's grizzly bears and mountain lions, ospreys, hawks, and eagles. There's deer, and it's just absolutely wonderful. I love spending time outside with my friends, my family, my dogs, and just getting to exist in a place like this. I am truly fortunate to have grown up here. However, I am really scared for Montana. Climate change is only continuing to worsen. In recent years, I've witnessed wildfires and flooding and sporadic storm events. Almost every single summer, there's a smoke season where the sky is smoky and there's a haze over our homes. Last year, I experienced an extreme flooding event not 5 minutes from our home on the Yellowstone River. It was devastating. Multiple homes were flooded and people had to be evacuated. It was a very, very scary time. Climate change is something that weighs on my mind a lot. It is something I think about every day. It's something that worries me. I'm very uncertain about my future. I don't know what's going to happen. This is why I became a plaintiff in Held versus Montana. I have a deep love for the natural environment, and I care about securing our futures, the future of our generation as well as future generations to come. It's really, really exciting that we have won this case because our Constitution has been upheld. In the Montana Constitution, it states that we have an inalienable right to a clean and healthful environment. And by winning this case, it's not only going to change how fossil fuel permits are issued in the state of Montana, but it will set a precedent for everywhere else in the world. I'm so excited for what comes next.
Regulations. And so I mean, I'll admit that sometimes I get frustrated or roll my eyes a little bit when I hear a lot about the children give me hope, the next generation gives me hope, the youth give me hope, because it can feel like a shirking of responsibility or just handing it off to them. Good luck, kids. But this really, I can't deny it. These kids are giving me hope. Like this is, they won. They are fighting. They made the connection between health and climate, and they won a really meaningful victory. And so I think that as we kind of go into our work, which in this panel is focused on the impacts of health, on mental health for children, impacts on children's health in general from climate change, having that same optimism and motivation centered from our hope in the youth. And so for me, that was a really grounding video. And so I'll just share a little bit before we kick the panel off. So Eco-America has been really engaged on the mental health impacts of climate change. Since 2015, we've worked with the American Psychological Association. We have some great folks from APA here with us today on mental health impacts of climate change report. And in the most recent version in 2021, researchers found more and more examples and new research of impacts on children, starting in utero, from climate change on mental health that is affecting that children's brains are being affected even before they're born. And so it became a priority for us as we were looking forward to kind of how we take next steps on this, that this next report that we are going to be launching October 11th, it is going to be focused exclusively on children and youth's mental health. And so we'll have a QR code. It's in your participant guide, and we'll be sending the link out on Demio. But we're really excited to kind of have this panel explore more about what the health solutions and climate actions that help to protect children's mental health and help to center that in all of our work. So I'm going to quickly introduce our panelists before I hand off the mic to them to talk a little bit more. So immediately to my left is Dr. Sam Ahdoot. So she is a practicing pediatrician, founder and chair of Virginia Clinicians for Climate Action. And Sam, you played a big role both in state organizations with the national AAP and kind of in driving the climate leadership and centering climate action in these national and statewide health organizations. And then our familiar face here is Leyla McCurdy. She is the chair of the Climate for Health Executive Committee. She's also the founder and chair of the APHA, the Center on Children's Environmental Health Work Group. And so it's really tons of really exciting work from Leyla, a long career of focus on environmental health, especially for children. And then at the end of the panel is Shalini Shah, Dr. Shalini Shah, who is a co-director of Boston Children's Pediatric Environmental Health Center, engaged in a ton of activities both at the state and national level on bringing climate communications and climate action to the bedside to patients and parents. So I'm going to jump off and just hand over the mic to you, Sam, to talk a little bit about your work. And we have a clicker here for your presentation.
All right, hi, can you hear me? Yep. Well, thank you so much for this chance to speak about climate change and children's mental health. Everyone who's caring for children today has seen the rise in youth mental health challenges across the country. Myself, my practice is about 20% mental health today. I have a colleague who's now transitioned to 100% mental health in my office. Between 2009 and 2019, feelings of sadness or hopelessness rose 40% and now affect about over 1/3 of US high school students. And this was before the pandemic, when things got even worse. And while this youth mental health crisis has many, many origins, climate change and environmental harm are clearly contributing to mental health suffering in children. And it affects children at every stage of development, as been stated. And we as pediatricians are already caring for these children, but it often goes the role of climate change often goes unrecognized. For example, children who come to us after extreme weather events, it is often seen as isolated events rather than in the context of a broader societal problem. And our role as pediatricians or anyone caring for mental health of youth, our role extends outside of the office, really to addressing the core of the cause of the problem, which is climate solutions. And pediatrician climate advocacy with a focus on hopeful solutions in collaboration with young people is really vital, not just for addressing the problem, but for promoting hope in our patients, and I would say and also in ourselves. So when I think about climate change and children's mental health, I like to classify into three main pathways, although these are not definitive and one could have totally different pathways. I think of them as direct and immediate through climate disasters, indirect and gradual through environmental change, and also vicarious through awareness of the problem. And I'd like to share some stories of the young people in constitutional climate lawsuits as sort of some examples of these and discuss what pediatricians are doing. So I'm first going to share the story of Vic Barrett from the Youth versus Gov in the Juliana versus US case. And Vic is from low-lying land in New York, which is threatened by rising sea levels and more frequent storm surges, and has felt firsthand climate impacts in the form of Hurricane Sandy, when his home lost power and his school and local transport shut down. So climate disasters are life-threatening events that cause significant mental health harms for children. And children can suffer from post-traumatic stress, anxiety, depression, aggression, and loss and decline in academic performance. And these events are also significant trauma that, in the absence of a supportive caregiver, can result in toxic stress, which can have lifelong physical and psychological effects. And pediatricians are recognizing this, and we are taking action. We are working to make sure that the specific needs of children, including psychological first aid, are included in disaster planning. The AAP launched a new council on children and disasters in 2019. And this, they're going to be presenting at the NCE in a couple of weeks here in DC. I don't know if you've all heard of the Western States Pediatric Environmental Health Specialty Unit, or PACU. That they have become a real national leader in information about wildfires and wildfire smoke. I can tell you that here in Virginia, I don't know if there's some folks from the Western PACUs here, but we were relying on that information in this summer and actually literally had it posted in offices across the state. And I'm very proud to say that the AAP was the first medical society in the United States to create a policy statement and technical report on health and climate change in 2007, which was updated in 2015. So next, I want to touch on gradual environmental change and how this also affects young people's mental health. And I'm going to share the short story of Claire. She's one of the young people, the youth plaintiffs from Montana. So growing up in Bozeman, her favorite activities have always been outdoors: skiing, biking, running, and hiking. Seasonally, she works as a ski instructor at a ski resort. However, due to decreasing snowpack, Claire's shifts are oftentimes canceled, negatively impacting her ability to work and make money. Declining snowpack and drought conditions are also reducing water flow through Bozeman Creek, which is the main water source for her family and their garden. I'm experiencing climate dangers getting worse each day, but my state government keeps pushing for more fossil fuels extraction and burning. And many young people have very deep connections to natural landscapes and wildlife, and harm to these causes grief and a sense of detachment and loss. And without significant emission reductions, these environmental changes will mount, and we as pediatricians will be seeing more children who are suffering these effects. So pediatricians are again taking action to address this sense of psychological desolation and elevating our voice for climate advocacy. Dr. Lori Byron, who's my fellow pediatrician, launched the American Academy of Pediatrics Climate Chapter Climate Advocate Program in 2020. And by 2022, every AAP chapter in the country had at least one climate advocate. 26 chapters have climate change committees, and many, including Virginia, have included now climate advocacy in their legislative priorities. Many of these advocates are also now serving as state group champions and are working with with trainees to bring education curriculum to medical schools. I can tell you that at VCCA, we have something called the Medical Education Collaborative. We have medical students, nursing students, and public health students, also pharmacy students, PA students, who are working to bring medical curriculum to their schools. And we've been successful at UVA School of Medicine, VCU, Georgetown. And now we're also working with students from Hopkins and West Virginia University, to name just a few. And lastly, I want to talk about just climate change awareness and just share another story of Hazel, who's another youth plaintiff in the national case. Hazel has loved camping, the ocean, and every aspect of nature since she was very little, but she didn't realize until she was 8 that climate change is threatening the environment. Hazel frequently visits the Oregon coast, where she enjoys body surfing, playing on the beach, tide pooling, harvesting seaweed, and hunting mushrooms. Increased surface and ocean temperatures, sea level rise, and ocean acidification caused by climate change threaten Hazel's future ability to enjoy these activities, which are important aspects of her childhood. So young people are increasingly aware of climate change. And this awareness, even in the absence of personal experience, can manifest as anxiety, sadness, or anger. And pediatricians are increasingly recognizing this awareness as contributing to the health of our mental health of our patients. And an important solution, a part of the solution is collaboration with young people to advance solutions. And I want to share with you just a few examples of how that's happening, about how pediatricians are collaborating with young people to advance hopeful solutions. One is the New York State's Children Environmental Health Center. They offer a summer academy, and the 2022 academy included 36 students from across the state who engaged in scholarly advocacy programs on climate change, projects on climate impacts of the health impacts of climate change. And pediatricians are also actively supporting the young people in our Children's Trust. VCCA worked with the University of Virginia Environmental Law Clinic and created an amicus brief in support of the youth plaintiffs in Virginia. Nationally, Dr. Jerry Paulson and other pediatricians have supported were participated in an amicus brief through Harvard Environmental Law Clinic in support of those youth. And Dr. Lori Byron in Montana was very involved in support of the Montana youth. So in summary, we know as pediatricians that children have a right to a safe and healthful environment, and preserving this right is an essential part of what we do to protect our patients. Thank you.
Thank you so much. Yeah, I think that these examples, both of the impacts, how children are experiencing climate change, how it affects their mental health, both physically and through experiencing those environmental changes and being aware of them, are really powerful, and those examples of pediatricians taking action. I know, Leyla, you've been working a lot on tools for public health professionals to directly engage with young people. Love to hear more about it.
Thank you. You can all hear me, I assume. Hi, everyone. It's great to see you folks in the room, and greetings to everybody online. And I do look forward to working with all of you about these issues that are so near and dear to our hearts. I can really feel the energy in this room, and I'm sure it's the same online. So happy to be here, to be part of this wonderful event. Again, I'm the chair of the Children's Environmental Health Committee of the American Public Health Association. And of course, I have a very important role with Climate for Health as well. And I'm proud to be able to collaborate among all these groups, because it requires collaboration. It requires all us working together to deal with this very important issue that we are facing. So thanks again for giving me the opportunity to chime in on an issue that I care deeply about: children's environmental health, children's mental health. They are all very, very connected. So as we heard from Ben and also from Dr. Ahdoot, obviously children are suffering due to climate anxiety. And unfortunately, most schools do not provide education about climate and health. Although one of the best ways we can support children is by equipping them with the knowledge, tools, skills, which can empower them to take action for climate solutions, which will in turn help their mental well-being. So recognizing the gap in the education system about the lack of climate and health education, at the American Public Health Association, we wanted to mobilize the public health professionals, and for them to really participate in this effort to educate and inspire children, so that is also contributing to their overall well-being, both physical and mental. Oh, yeah, here's my slide. You can see the, yeah, I'll take that here, thank you. And you can see the toolkit we created for so that it can provide all the information and the tools for public health professionals to be able to educate kids It's posted, as you can see, the cover is on the slide, and it's posted on the APHA Center for Climate and Health Equity's webpage, and it is linked from the Children's Environmental Health Committee's website. I know folks online are able to see the links directly, and in the room, if you're not on your demo, yeah, I put out some flyers, which I will talk about in a little bit in depth, but if you use the QR code on the flyer, you can directly go be able to download the entire toolkit. Now on the website, we also have additional tools and resources that can be used as part of developing a program and actually implementing the program. And we also have the recording of a webinar that we held in February, which may be of interest, that talks about in detail about the kit, how it can be used. We are going to be having another webinar towards the end of October, which we'll announce very shortly. So we invite you to kind of stay tuned to that. So let me talk about the toolkit a little bit, what it is, right? So at the heart of the toolkit is the Climate and Health Lesson Plan for grades 9 to 12, so for high school students. So the lesson plan is based on the National Institute of Environmental Health Sciences curriculum, which I had the privilege of being involved in developing a few years ago. And that curriculum meets national common core standards and is aimed directly at teachers. Unfortunately, again, schools, because of all the challenges they are facing, are not really taking this and having their incorporating into the education system. So again, we felt that the public health professionals are uniquely qualified to really get involved with this. And we adapted the NIEHS lesson plan to make it easier for the public health professionals to present in their local high schools as guest lecturers. In addition, we added a couple of extension activities, one of which is on environmental justice. Now, here is the outline of the lesson plan, which should take about 100 minutes to deliver. And it is very, if you can move, I can move it, or are you moving my slide? Okay, so this slide is really, I'm not going to go in depth. I just want to demonstrate the fact that it's very interactive and engages students very actively. Oh, I'm sorry, yeah. Okay. So this slide shows the Children's Environmental Health Committee's pages where we are providing a lot of tools and resources that we have created. And one of the tools that we created is directed to students, which is on your tables actually. And as you will see, as you can see, that we are providing multitude of options for children to get involved. But we are starting with self-care as the number one step. And several of the resources are actually from Eco America. So And we're also looking forward to, of course, posting the new report from Eco America on our website as another tool for the educators to be aware and our broader public health community. October is going to be an exciting month in terms of developments. I've been working also with the Climate Psychology Alliance, and they are developing an educator's guide to climate emotions, which will release in October, which we will again provide on our website. Also, the Climate Psychiatry Alliance launched a youth group this summer, and our lead, Dr. Elizabeth Pinsky, is going to be our speaker at the APHA annual meeting session in November. And the title of the session is Climate Action Brings Hope, Youth Engagement in Climate Solutions that Bolster Children's Physical and Mental Well-being. So I think that's what we're all trying to do. So with all this momentum, I would like to invite you to join us. When I say public health professionals, that doesn't mean you need to have a public health degree. We are all public health professionals because we care about the public's health, and we have the background to actually make something out of the content that we are presented. And we can all be volunteers in our communities to bring this to the high schools. Now, you can choose either to do it yourself, or you can use this recruitment flyer to engage others to actually go to the schools and provide this lesson plan. So, also keep in mind, the tool can be adapted to any grade level, including upper education levels. Some of our colleagues have already taught it at the college level. Even MPH students have been offered this toolkit and the lesson plan. And we would love to hear from you. If I'm not going to say if, when you actually go and deliver this, because we, first of all, want to be able to track. Secondly, we want to amplify your great work. So my colleagues, Catherine Catalano and Michelle Loosely, are here from APHA, and we would love to connect with you either during this meeting or anytime afterwards. Please feel free to contact us, and we would love to work with you. Thank you so very much.
Thank you, Leyla. Yeah, this tool is so exciting to have. It is something that comes up all the time when I'm training either clinicians, public health professionals, or anyone. Just how do I talk about this with kids? How do we get this into our schools? How do we start introducing this in a way that is empowering? I think that people know the phrase "action is the antidote" to this kind of anxiety. Also, information, having the information and that feeds into action is really, really, really important to help support these kids. Shalini, I'm really excited to hear about your work, again, more focused on clinical care, bedside work, as well as all the other projects you're on.
Thanks, Ben, and thanks everyone for having me here. I'm so honored to be part of this and inspired by all of you here and online and everyone's work in this space. Let's see. So I just wanted to acknowledge kind of as part of the PSU program that was mentioned earlier, I am funded in part by the ATSDR and EPA through our PSU program, though I don't represent them directly. And kind of in the interest of time, we've heard a lot about kind of so many different angles at which for us to engage on climate and health, from education, from advocacy, from researchers, from so many angles. And I wanted to talk a little bit about kind of what we can do in the clinical setting and the work that we've done that we're really proud of through our collaborators at Boston Children's and the Region 1 PSU to kind of bring environmental justice and climate considerations into clinical care directly. So here on the right is our climate prescription educational handouts. We've developed educational patient-facing handouts in an effort to kind of start and support these conversations in clinical care. We're at this critical transformative moment in medicine where from meeting families and taking a history to considering your differential to how you care for them is really going to be affected by the climate crisis. And so to provide comprehensive up-to-date care providers need to be thinking about this up front and from start to finish through their anticipatory guidance, weaving this in as it's appropriate. So we're hopeful that these handouts, they highlight a climate health connection, they have actionable steps families can do to prepare themselves, learn more about the issue, and protect their children's health, as well as national community level resources. As part of the PACU, we're working to kind of create geographical subsets of these. As we know, climate is the threats of climate are so specific to where you are working from. And so these are hosted on our website and now partnered with Eco America. And we look forward to kind of learning from providers who are engaged in climate in different areas about how this can be helpful to you. We've also kind of worked on environmental screening in partnership with the Boston Children's Primary Care Asthma Program, where we are actively screening patients prior to their visits about a variety of different environmental hazards within their home, including assessing for differing climate vulnerabilities to extreme weather. Providers are able to educate within their clinic visit about that, and we've also received funding to be able to provide mitigation resources like air conditioners and other methods to deal with these issues and help families on the individual level. And then lastly, kind of, it's been mentioned a few times today that sometimes we feel like you have to be an expert to get started. And I hope that we are moving out of that, but in terms of wanting more support for providers to bring this into clinic, which may be a new space for them, I worked with a group through the AAP Climate Network of collaborators to develop a maintenance of certification project that's quality improvement based, that has 2 educational modules, one that goes through the foundations of climate, health, and pediatrics, and the second on how to communicate about these issues directly in primary care. And for those who want to do the full research initiative, you can get American Board of Pediatrics Maintenance of Certification Type 4 credit. But for those who are not practicing providers or don't need that credit, you can do the modules through the Emory Nursing webpage just to access the content and learn from it. So this is a really good place for people to feel kind of more educated about this issue and feel like you're doing this in an evidence-based way. So those are kind of our 3 main things we wanted to highlight. In context of children's mental health, I think talking about these things in a way that patients and families can see that their clinicians are worried about helps them feel not alone, that it's not the youth's problem to fix. We are engaged, we're working on it, and it makes it all less lonely for everybody, myself included.
Thank you so much, Shalini. Yeah, the climate prescription pads that they've developed, we're featuring them on our Climate RX website. If you hadn't heard me talk about Climate RX, so this is our campaign to make climate engagement part of those bedside clinical interactions, part of your work out in community, talking with colleagues, patients, community members about climate change in the context of health. That having people think about climate change, again, from a healthcare provider in their clinical visit or from a public health professional, really changes how they continue to think about health and how their commitments to take actions in order to protect their health. And so the tools that developed by Boston Children's are really great, actionable, printable resources. We're featuring those on the For Providers section of Climate RX. And then we also have a For Patient side that's all about those actionable steps that you can take to protect yourself, include prevention, resilience, and then start taking action to reduce your own impacts and to support other people in your community. So we're really trying to make this really straightforward. We have badges out on the tables out front. Also, if you're with a facility or with a university or with any organization that's community facing, we have bags of badges ready to go out for bulk distribution. We have hundreds of badges here on site. Also happy to answer emails from anybody about us sending a bulk order to you. So really powerful way to bring that climate conversation into those everyday interactions. And I think that feeds right into one of the questions I have, and I'll leave this up for anyone to answer who'd like, but I know that I've heard from people that they don't want to bring up climate change, especially for children, because they don't want to make the anxiety worse, that they themselves are trying to avoid it. Kind of what would you say to somebody who says, this kid already has asthma, has 2 other conditions, their parents have their own issues, how do we bring up climate change in this context where it's just going to make them even more worried?
Well, I see my role partly as helping people understand changes. So I have children, many patients with seasonal allergies, and when they've come to me, particularly in the spring and increasingly even in February or early March with symptoms, I see part of my job as their pediatrician is helping them understand why their allergies are coming earlier, and just sharing with them that it's getting hotter, and so plants are blooming earlier and later, so the allergy season has gotten longer. And that's why it's important that you start your allergy medicine and potentially in some patients your asthma preventative medicine in late February instead of mid-March. And in fact, at this time of year, I'm often, when I do asthma checks with children throughout the year, some of whom have allergy-induced asthma, we'll be writing that down. Like start your preventative medicine in the middle of February because the plants are blooming earlier now than they used to. So it can have very, very relevant clinical applications and helps people understand, the nature of change and the relationship with climate change and their health.
To also respond to that, I'd encourage clinicians to really feel confident in the importance and value of your relationship with your individual patient and family, and the expertise you have in being able to read the room, see where they're at, perhaps on the spectrum of are they ready to engage on this, and be aware, are they suffering from climate anxiety and doom? And I think we have more skills than we realize to be able to navigate that in a way that it will be safe and helpful. I'm the first to admit with my patients that I suffer from my own oscillating feelings of climate anxiety. And I think being able to validate that and sit in that space with families is really empowering and I think can be healing. And my partner, co-director, close friend of mine, Marissa Hopman, always says, like, medicine keeps us humble. And I think the more we're willing to be vulnerable with our own patients and sit in that space and navigate together what makes the most sense for them, whether that's starting your inhaler early or connecting them with a regional climate youth program for them to feel more supported by a community, you can really tailor that to your family.
Do we have room for one more response? I think that's a great question, and I'm really very excited to hear from clinicians. I know you too would, but that you are willing to make the time to listen to your patients and being able to, respond to their needs in this area. But, I would thank you so much, and we do need that very much. But there's a societal aspect too. I mean, we can't only rely on clinicians for this. Clearly, I think we all need to participate in efforts to educate parents too, equip them with skills that can open the doors for these discussions. I mean, we don't have to start the conversation with climate change topic, but kids are already hearing it everywhere. So I think we need to be in an active listening mode and hear what they are concerned about, and then respond to that in an educated way to offer support and give them the tools so that they feel in control. I think what I understand, I'm not a clinical psychologist, but I read these things. One of the worst things that can happen in terms of mentally is not being able to be in control, right? So we can give some tools to kids in the way that they can act, they can participate in solutions. That's going to make them feel like they actually can deal with their anxiety. So from societal perspective, I think we need to take that into consideration too.
Thank you so much, Leyla. I think we have time for one or two questions from the audience or from online. I have the iPad right in front of me if anyone's sending in questions online. Any questions from the audience? Everyone's ready for lunch. Yeah.
Hi, Erin at Newark. I'm wondering, just with time pressures, do you find as clinicians, do you have enough time for these conversations and a visit, and how do you push for enough time?
I'll leave that up to our two clinicians at the table.
I generally, it doesn't take that much time. It's literally can be just a few seconds. Like if I'm seeing and it's often incorporated into things I'm already doing. I'm just helping families make the connection. You know, for example, when I'm talking with parents of a newborn, you know, and in this summer, you know, I was talking about, well, right now, because of the poor air quality, you can't take the baby outside. You need to stay inside, you know, where you have proper ventilation, or I'll be talking about in the heat, and it's a time of, you know, in August when it's very hot outside. I'll talk about the importance of waiting to take walks, and taking walks in the morning or in the afternoon or in the evening when it's less hot, and that summers are getting hotter. So therefore it's more important to watch the heat because your baby is more vulnerable than other people. So generally it's just incorporated for me into when I'm already talking with families, and it just takes a few seconds.
Yeah, I would echo that as well. We really try to fold things into anticipatory guidance, especially in pediatrics, is so part and parcel of what we do. And so reshaping that to include kind of the climate consideration can save time. And I also think there's a lot of beneficial to having a longitudinal relationship. So if you are working in a clinical setting where you're able to connect with these families kind of more than that singular visit, then you can also kind of assess where do you need to dig deeper based on what you're hearing or seeing based on their medical history, and revisiting that at a later time.
And I would just add to this that once again, the Climate RX badge is a great tool to make that conversation super short and have an endpoint, because sometimes people might have more follow-up questions than you can answer, or you anticipate follow-up questions or pushback. Being able to say you can learn more about how climate affects your health by scanning this badge and going to climaterx.org. You know, grounding it in those immediate health impacts with the immediate adaptation, that the things they need to do to protect their family's health, then with the additional context information they can gain from these tools can then help square that circle and help give that time-sensitive information while also connecting them with more resources and more opportunities to act. But I want to thank our panel. I thought that this was such a great conversation for connecting both the clinical, the public health, and the mental health impacts of climate change for children, and how we can, as health professionals, bring this forward, partner with our youth, and pull them forward. So thank you again.